All gentlemen over 50, here's the twist most men miss. The quickest way to a steadier erection isn't to try harder, it's to lower anxiety in your body in the first 2 minutes of intimacy. Because when adrenaline spikes, your arteries clamp, like squeezing a hose while trying to water your roses.
Try this mid-moment. Inhale through your nose for 4. Exhale through your mouth for 6 to 8, twice. Let your jaw soften. Let your pelvis drop. That's your 2-breath reset. It switches you from fight or flight to rest.
Gentlemen over 50, here's the twist most men miss. The quickest way to a steadier erection isn't to push harder for performance. It's to lower anxiety in your body within the first 2 minutes of intimacy. Do that, and you often get more firmness, more consistency, and more freedom in bed. I'm Dr. Marcia Angel, a urologist with over 30 years in clinic and thousands of patients. This is educational, not medical advice. Talk to your doctor for personal guidance. While you're here, subscribe, hit the bell, and tell me if this helps. Type 1 if helpful, 0 if not. Before we go there, notice how pressure builds with age. After 50, you've lived some life. You've weathered surgeries, stress at work, changes in testosterone, and maybe medications. You want presence more than performance. You want dignity without the fear of will I fail. You want freedom, to be close without a scoreboard. That's why this matters now. When anxiety hijacks your body, the penis pays the price. Here's where it gets surprising. Erections are not only about blood flow, they are about signals. Your brain releases nitric oxide, which tells the arteries in the penis to open. But anxiety turns up adrenaline, and adrenaline clamps those arteries. It's like squeezing a garden hose while trying to water your roses. The pressure is there, but the flow is blocked. Studies suggest about half of men in their 50s report some degree of erectile difficulty, and anxiety is linked with a much higher chance of an off night. You are not broken. Your nervous system is doing its job a little too well. Hold that thought, because in a moment I'll show you a 2-breath reset you can use when worry hits mid-erection. And I'll also give you one sentence to say in bed that diffuses pressure on the spot. Let me introduce Alan, 57. He hadn't dated since his divorce. First night with a new partner, he lost his erection twice and felt crushed. He came to me saying, "My penis is failing me." It wasn't. His nervous system was trying to protect him from a perceived threat, the fear of disappointing someone new. We practiced a simpler plan. Slow the start, soften the pelvis, breathe out longer than you breathe in, and keep pleasure going even when the penis takes a pause. 2 weeks later, he told me, "I kept my breath steady, stayed in the moment, and my erection came back." We both laughed. It was the best night in years. That isn't magic. That's physiology and consent working together. Now that you see why this matters at your age, let's set the stage before the bedroom. Anxiety is state-dependent. If you sprint into intimacy from a stressful day, your body is still in fight or flight. An hour or two before sex, take a 10-minute walk. Walking lowers adrenaline and boosts nitric oxide in your vessels. Go easy on alcohol. One drink may help some men feel less tense. More than that often dulls erections. Keep caffeine early in the day. Many men sleep better when they stop caffeine by early afternoon, and better sleep is strongly linked with stronger morning erections. If you've had a heavy meal, give your body time. Blood is in your gut, not in your penis, right after a big dinner. When you get close, start slow and gentle. Comfort is not a luxury, it's the ignition switch. Dim the lights if harsh light makes either of you self-conscious. A warm shower together can ease muscles and provide a natural reset. Begin with non-genital touch. Kiss. Breathe with your partner. Keep your jaw soft. A soft jaw tells your pelvic floor to ease. If you feel tension in your pelvis, let it drop like a hammock. That's a reverse Kegel. Instead of clenching the muscles that stop urination, relax them on purpose. Most men after 50 are better served by releasing those muscles at the start rather than squeezing. Clenching too soon can trap blood at the base and make the head of the penis less firm. Relax first. Later, a gentle Kegel, just a 2-second squeeze, can help keep blood in, but the key is calm before contraction. Before we go there, notice how consent and communication lower anxiety without a pill. Touch and words are powerful. Here's that sentence I promised. I want to go slow, focus on your pleasure, and let my body warm up. No rush, no score. If you say that kindly and mean it, many partners relax with you. Ask, does this feel good? Or do you like more pressure or less? When the clitoris and vulva are well cared for, by hand, by mouth, by vibrator, something lovely happens. You both stay connected even if the penis takes a moment to catch up. Now the erection isn't a pass-fail test. It's part of a bigger dance. Here's the 2-breath reset. When you feel nerves spiking, pause wherever you are. Still touching, still close. Inhale through your nose to a count of 4 and feel your ribs widen. Then exhale through your mouth for a count of 6 to 8, as if you're fogging a mirror. During the long exhale, let your pelvic floor drop and your belly soften. Do exactly 2 of those breaths. That long exhale switches your nervous system from fight to rest and receive. Most men notice their heart rate slow, their mind steady, and their penis begin to refill. Then keep going with some form of pleasure. Hands, oral sex, kissing, so the pressure stays low and the connection stays high. That is your on-the-spot way to restore flow to the hose. Let's talk rhythm, because the penis loves rhythm. Start at a level that feels like a 6 out of 10 on arousal. Pleasant, not frantic. When you feel yourself climbing, pause and breathe rather than powering through. This is the start-stop technique many sex therapists teach. Use your hand or your partner's hand while you breathe. It keeps arousal steady without needing constant penetration. If penetration is painful, or if pressure rises, stay external. Many couples find that focusing on the clitoris with fingers or oral sex while you relax sets you both up for deeper intimacy later. Consent and comfort check-ins are key. A simple, "Do you want me softer or slower?" makes the moment feel safe. With safety, erections respond. Terry, 52, told me, "Doc, porn wrecked my expectations." He was used to fast, high-intensity stimulation and instant erection. Real intimacy felt slower, so he thought something was wrong. We rebuilt his habits. During masturbation, he used a lighter grip, added lube, and practiced that 2-breath reset when he felt anxious or too close to ejaculation. He stopped chasing a peak and learned to enjoy the plateau. In 4 weeks, he said, "I can last longer, and my erections feel fuller with my partner." Again, not magic, just retraining the system. Positions matter when anxiety is high. If you feel pressure to perform, try side-lying spooning, where your bodies are close and your breath synchronizes. Eye contact helps some men, but not all. If looking into your partner's eyes spikes anxiety, rest your forehead to hers, or look at her shoulder or chest while staying connected. Let your thighs do some of the work. The pelvic muscles don't have to carry everything. If you need to pull out, stay present with your hands and mouth. Say, "I'm staying with you," and keep going. That keeps you in the game, mentally and physically. Here's where it gets surprising again. A little strategic strength can ease anxiety. 2 short sessions a week of simple resistance work, squats to a chair, light deadlifts, or step-ups, help many men feel grounded and increase blood vessel health. Daily walking for 20 to 30 minutes supports pelvic circulation and reduces inflammation. Some men notice improved morning erections within a few weeks of consistent movement. What about drinks that support calm and flow? Many men benefit from a simple evening routine, a decaffeinated green tea or chamomile with a squeeze of lemon, to signal the body it's time to wind down. Green tea has L-theanine, which may support a calm, focused state without sedation. Hydrate well during the day and taper fluids after dinner so you're not up all night. Heavy sugar, creamy coffees late in the day, and high alcohol before sex often work against you. Miguel, 63, a widower beginning to date again, carried grief and fear into bed. His blood work was okay, but the anxiety reflex was strong. He started a nightly wind down, lights dim at 9, phone off, 5 minutes of breathing, and a short journal note to park worries until morning. He added a morning walk and light weights twice a week. He told me, "I still get nervous, but I can feel my body settle. Morning erections are back most days." That's the nervous system learning a new pattern. Let's address medications and tools. PDE5 inhibitors, sildenafil and its cousins, can be very useful. If your doctor says they're safe for you, consider using the lowest effective dose. Here's the key. Use the pill to buy calm, not to chase performance. Combine it with your 2-breath reset, reverse Kegels at the start, and slow touch. Some men try a vacuum erection device for gentle practice. Used with a band for only a short time and good lubrication, it can help you see what a full erection looks and feels like again. None of these are cures, but they may support the routine you're building. Before we wrap, let's close both loops. The 2-breath reset you can use mid-encounter is inhale 4, exhale 6 to 8, pelvis soft, jaw loose, twice, and keep pleasure going with hands or oral sex. And the one sentence that shifts pressure is, "I want to go slow, focus on your pleasure and let my body warm up. No rush, no score." Use both, and you move from performance to presence. If ejaculation feels pressured, choose connection over climax. You can enjoy your partner's body, her clitoris, her vulva, and stop before ejaculation if that keeps anxiety lower. You can return to penetration later or not at all that night. You can place a small vibrator on the clitoris while you kiss. You can ask for her hand on your penis while you breathe. You stay in the moment without making your erection the only measure of success. Now that you see how the nervous system, your breath, and your pelvic floor work together, let's pull it into an easy flow you can try tonight. Set the environment: soft light, warm room, a towel, and lube handy. Begin upright or seated so your chest can expand. Share a kiss, then sink 2 slow breaths. Move to gentle touch, outside first, clothed or unclothed, no rush. If your penis starts to fill, great. If not, keep exploring. When it does, choose a position that feels low pressure, spooning or her on top so you can breathe deeply. If anxiety rises, use your 2 breaths and keep hands and mouth involved. Check in for consent and comfort. Afterward, stay close for a minute. That's aftercare. You're wiring safety into the experience. A quick word on mindset. Anxiety loves certainty. Give it a simple plan. Even if my erection rises or falls, we keep enjoying each other. There's always another path: hands, oral sex, massage, a pause. You are not your performance. You are the partner who shows up, breathes, listens, and adapts. That's dignity. That's freedom. If you try this and still struggle, talk to your doctor. Blood pressure medicines, diabetes, heart disease, sleep apnea, depression, and low testosterone can all play a role. A good evaluation checks your heart and hormones and makes a plan. Therapy can help too. Cognitive behavioral therapy teaches your brain to spot and quiet the "what if I fail" loop. Some men notice real changes within weeks when they combine therapy with the routine we just covered. I'll leave you with this. Your body is not at war with you. It's a very loyal dog that sometimes barks too loud when the doorbell rings. Teach it a new trick: slow breath, soft pelvis, kind words, steady touch. With practice, anxiety fades, and erections return as part of a bigger picture: connection, confidence, and choice. If you found this helpful, subscribe and hit the bell, and tell me now. Type 1 if helpful, 0 if not. And if you want to keep building confidence, watch next. Insert next video title for closing bridge. I'll see you there.